Welcome, folks. Steve Adubato here. Everything you've ever needed and wanted to know about arrhythmias or dealing with an arrhythmia. We have Dr. Jonathan Steinberg, director of the Summit Medical Group Arrhythmia Center. Good to see you, doctor.
Thank you.
Now, I use the word arrhythmia only because it's been in our family. People have dealt with heart issues, arrhythmia. What is it?
Very simply, it's a disturbance from a normal rhythm. But it has an enormous spectrum ranging from very benign arrhythmias or irregularities that require nothing but reassurance to potentially fatal arrhythmic events.
What causes it?
Again, very variable. Sometimes it's just the natural behavior of the heart, but most often it's due to some illness in the heart, some cardiac condition. If you've had a heart attack, if you have high blood pressure, you're more vulnerable to all sorts of potentially dangerous arrhythmias.
So, it's so interesting. I think there's some misconceptions, and maybe just for me, but sometimes I confuse, sometimes when I'm getting here to the studio, if I'm working out in the morning and there's not enough time between the workout and here, and my heart's racing faster, I think that's an arrhythmia. What's the difference between arrhythmia and your heart just beating faster?
So the heart has an incredibly complex electrical system. Electrical, that controls the pumping of the heart. So that electrical system is very sensitive to what you're doing or experiencing. So when you're exercising, there's a great deal of release of adrenaline. Adrenaline stimulates the heart to beat faster and deliver more oxygen around the body to your muscles that require more oxygen because you're active.
But that's not an arrhythmia.
That is a physiologic, normal response to activity.
But an arrhythmia is something that is a defect.
That's correct. It is something that is abnormal that the heart should not, in its day-to-day working, experience.
How would one know they have it? How do you detect it?
Sometimes patients feel it.
So what do you feel?
So it's very variable, and sometimes it's subtle. It's real obvious if you feel an extra beat or a skipped beat. It's real obvious if you feel a sudden, abrupt, rapid, racing, chaotic heartbeat. But it's much less obvious if you suddenly feel more tired than usual, or if you have more difficulty with taking out the garbage.
Walking up the stairs.
Walking up the stairs. And many patients will walk into my office and say, well, you know, for the past year, I've had difficulty taking out the garbage. And I always thought I'm just getting a little older, I'd gained a little bit of weight. Turns out they've had an arrhythmia for the past year.
What do you do? Say someone has an arrhythmia. Obviously, it's case by case, patient by patient. We're not going to diagnose from here. But there are medications?
Yeah.
What are some of the most effective treatments out there?
Well, the first step is to make the diagnosis. Many arrhythmias are intermittent. So you walk into your doctor's office and you say, I feel X. Doctor does an EKG. EKG looks perfectly normal. So in that case...
Excuse me, so it's going like this. You don't see this?
No. Often not, when it's intermittent. So you have no clue. So you have to be a subtle diagnostician. And often that requires placing a monitor or having patients wear a monitor for a period of time. And during the period of time when they experience some symptoms, making an EKG recording. And there are real cool monitoring systems available now. There are some that we put on that are essentially a Band-Aid on the chest wall. And there are some that can be done through your own smartphone. So
what do you mean through the smartphone?
You just hold the smartphone in your hand, and you can then generate an electrical recording on your phone. It is saved, and then it can be transmitted or sent to your physician. Incredibly powerful tool to record intermittent events, even that occur over a prolonged period of time.
It's amazing.
Amazing.
So, doctor, let me ask you this. You were telling our producers about Botox, and I'm saying, listen, I know about Botox. I will fully admit I've had Botox, except my explanation is I've had them for migraines back here. Believe what you want. But more importantly here, Botox is being used in connection with arrhythmias. So I'm trying to understand, what would Botox, you're not doing it to take lines away. Where's the Botox and what's its connection to the heart?
So you asked me about what happens when your heart is very rapid after you exercise. And I indicated that adrenaline stimulates the heart. So there are two opposing forces in the nervous system, and the heart is heavily innervated and therefore very sensitive to the input of these portions of the nervous system. One is stimulatory and one is the opposite. And both together often create an environment that allows arrhythmias more readily to occur. So Botox is a very powerful inhibitor of nervous system traffic.
Does it deaden the nerves?
It prevents the movement of chemicals that are involved in nervous system traffic. So when you inject Botox into the nerves that overlie the heart, you prevent some of the stimulation or inhibition of the heart electrical system, and that can prevent arrhythmias. And we did some pilot studies in Europe, and there was a dramatic reduction in atrial fibrillation in patients who received Botox or botulinum toxin during the operations for bypass surgery. And we're now in the midst of designing a large-scale clinical trial that will test it in large numbers of patients.
You think more people will ask for it?
I think so, because one of the beauties of doing this kind of work for arrhythmias is that we're actually not working in the heart. We're not destroying heart tissue to prevent an arrhythmia. We're modulating nervous system input into the heart.
Last question, doctor. What's the connection between arrhythmias or dealing with an arrhythmia problem and lifestyle?
Less than we'd like. There are certain things that you do that can trigger arrhythmias. If you drink in excess, there's a syndrome called holiday heart. You go to Las Vegas for the weekend, you overdo it, you come back with atrial fibrillation. Described decades ago, really does occur.
Heavy smoking?
Heavy smoking creates, over the long term, the abnormalities that encourage arrhythmias. Being overweight, same thing. And we've learned that if you stop smoking, if you lose weight, that can actually prevent arrhythmias as well.
Are you saying that ultimately a lot of this, beyond all that, is genetic?
A lot of it is genetic, and that's the one component of how arrhythmias occur that we understand least.
Dr. Jonathan Steinberg is the director of the Summit Medical Group Arrhythmia Center. I want to thank you for joining us. An important topic affecting a fair number of Americans.
About 2.5 million people.
I would say that makes it very important. Thank you, doctor.
You're very welcome.
We'll be right back.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by the New Jersey Education Association, New Jersey Council of County Colleges, New Jersey Resources, Horizon Blue Cross Blue Shield of New Jersey, New Jersey Sharing Network, Johnson & Johnson, and by the New Jersey Office of the Insurance Fraud Prosecutor. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.